Diabetic retinopathy is a disorder where patients who have diabetes, over time, the diabetes damages the little blood vessels that look after the light-sensitive layer at the back of the eye called the retina. And when it damages these blood vessels, it can either make them shut down or make the blood vessel wall leaky. And either way, that can affect vision. And if we pick up these changes promptly, we can treat it and prevent visual loss. So before patients develop visual loss, we can, in most patients, notice changes in the retina, which could be changes in the caliber of the large blood vessels, hemorrhages, or little dilated capillaries before visual loss occurs. And in most, but not all patients, this is a slow progressive change. And by looking at the back of the eye, either with a digital camera or by clinical examination, we can pick up these changes and treat appropriately to prevent visual loss. When we look at the eye, we can grade the severity of retinopathy, which will guide us in how frequently we should see you, and also help us interact with your diabetologist or your GP to improve diabetic control, which will also prevent the progression of retinopathy. Untreated diabetic retinopathy in a minority of diabetics can cause severe visual loss. But since the advent of effective treatments over 30 years ago, initially with laser and more recently supplemented with various medicines we put in the eye that can limit blood vessel growth called anti-VEGF injections, by picking up the disease before visual loss occurs, which is why it's important to see a retina specialist regularly, and prompt treatment, it is unusual now to be blind from diabetes with regular screening and prompt treatment. So unfortunately, once you're diabetic, no matter how well you're controlled, your diabetic control is not completely normal, and there is a risk of progression. The better your control, and independently, the better your blood pressure control or renal function control, the lower the risk of progression, but it doesn't eliminate that risk completely. If you are your diabetes is reversed, i.e. you control your type 2 diabetes completely and you become normal glycemic, or if you're type 1 and have a transplant, then it will limit the progression after that. Our approach to treatment depends on how diabetes affects your eye. It will cause what's called diabetic retinopathy. It can cause diabetic maculopathy, and it can cause earlier onset cataract. For diabetic retinopathy, where the diabetes damages blood vessels in the peripheral retina, over time the eye does not have enough blood supply and oxygen, and therefore grows abnormal blood vessels that grow into the cavity of the eye that can leak and bleed. And by prompt treatment with laser and or injections of a drug that stops blood vessels leaking called anti-VEGF, that can massively reduce the risk of visual impairment. With diabetic maculopathy now, the mainstay of treatment are the anti-VEGF injections. Occasionally, laser or corticosteroid implants are used. And lastly, diabetics are more prone to earlier cataracts. And although standard cataract operations are highly successful, it's very important in diabetics that your maculopathy and retinopathy are appropriately controlled before cataract surgery, as these may rapidly worsen if uncontrolled before cataract surgery.